Welcome to the NSCHBC Edge Podcast, leading the way in the business of medicine. Now here's your host, Terry Fletcher.
Hello, everyone, and welcome to the NSCHBC Edge Podcast. I'm your host, Terry Fletcher. The Edge Podcast is brought to you today by the National Society of Certified Healthcare Business Consultants. Our goal is to discuss healthy business principles, have conversations on the business side of medicine, so that you and your practice can be profitable and successful for years to come. This week on the Edge Podcast, I welcome my good friend, healthcare consultant and compliance professional, Stephanie Allard of Stephanie Allard Consulting. Stephanie is a certified compliance consultant in the revenue cycle management space and a subject matter expert in more than 40 specialties and subspecialties. She also performs forensic audits in the healthcare space that includes focused reviews used in court cases and payer investigations. Stephanie and I have worked on many auditing and educational projects together, and we continue to collaborate in the industry. So I'm so happy to have her today. Stephanie, welcome to the podcast.
Thank you, Terry. Happy to be here.
So today we're going to have kind of a chat back and forth conversation. We're talking about hiring consultants, and what better, podcast to do that than on the Edge podcast, since this is the National Society for Consultants. And we really want to focus on healthcare consultants and what you'd be looking for, because I know sometimes within your practice, you don't have, and I'm talking to our listeners, you don't have every, subject matter expert that you need. And so we first have to really look at, before you hire a consultant, what is it that you need, and is a consultant necessary? So before you figure out who's your best choice, consultant services can require additional investments of time and energy. You may have to organize information for them. And, there could be workflow issues, or it could be just, this is what we need. It could be focused. And you just want to make sure that consultants are useful to you if you don't have the right employees able to perform the necessary research or whatever you need to, assist in your solutions to any problems that are coming up. And so I know that sometimes a company attempts to address internally some issues without much success, and then they go on to the consultant. So Stephanie, I'm going to turn this over to you for just a second. When a practice or an organization, especially in the healthcare field, decides is this consultant necessary? What do you find that they don't do first before they jump into the hiring process?
So I know for myself personally, a lot of what I see is that the practices are sometimes not even aware of what it is that they need. So I thought that was interesting that you said, you need to do some work internally. And for me, what I think is helpful, or what I think would help others, is that when you are going to that meeting, have at least the outcome goals in place. So if you don't know what you need, the support you need, the resources you need, and that's even a part of what you're coming to an expert for, in that situation, you want to make sure that you have a list of what your problems are, or what your concerns are, and what you need the outcome to be. And then from there, people should be able to help you navigate. Terry, I know we're going to talk, I'm not going to dive into it right now. I know we're going to talk some about how to vet that process, but
Right.
If you don't know where to start, those are two things that you could come forward with to help someone else see, if that's a good fit.
Yeah, I've noticed that when somebody, for example, emails me or calls me, or I even get direct messages, as I know you do, LinkedIn and different social media contact, saying, hey, do you do this? We need help. It seems like when we finally get the ball rolling, or we have a conversation about what's needed, there's not an objective there. That's like, we don't know they don't really know what they want to accomplish. They just know they need somebody because maybe they're just pulling out their hair, trying to figure out, okay, why are our revenues down? Why somebody, maybe one of the providers has said, we're not collecting like, the guy down the street or the gal down the street or whatever. So it seems like sometimes I feel like people jump in to get a consultant just because they were told, or something was brought to their attention that may or may not be accurate.
Yeah, I agree.
Yeah. So when we next look at we kind of determine the amount of help required. So, a consulting firm may offer, a lot of services, and sometimes I feel like some, firms, over promise and under, what is it called? Over promise and under deliver.
Yeah.
And, so you have to make sure, and again, talk to our listeners, when you enter negotiations or discussions with an external consultant, make sure you have a clear understanding of the type and amount of help that you require. So sometimes a company can benefit from giving as much responsibility as possible to the consultant and then paying them to resolve, an issue entirely. But other cases, you may be able to work through a problem with the consultant to better prepare for a similar challenge in the future. I know, hiring a consultant, for example, for AI or IT issues or cyber attacks, those are completely different than maybe in yours and my space, revenue cycle management, as we do a lot of audits, which can be subjective, but really trying to figure out, do they just need a coding audit, a billing audit, a financial audit? Do they need an audit of processes? I mean, we found that once you get into the coding audit and find, some irregularities or some inefficiencies, then we have to kind of go, I hate to call it a back door, but then we have to figure out, okay, where did this start? You and I both are like, how did they start doing it this way when that's not even part of the published guidance on how to do things? And, I'd be interested to get your feedback because I know, I deal with I would say probably 10 to 15 specialties, but I know you deal with a ton of specialties, even stuff that I don't care to. And you probably like, oh my gosh. I know one thing was weight loss drugs. I learned so much from you on just the weight loss drug thing. And people are just like, what do you mean? We can't bill for everything we do? And you're like, that's not FDA approved. And so it's interesting when you see some of these spaces, how, people trying to get the consultant input or insights, they don't, I'm not saying they push back, but they don't always know what they need.
Yeah, and you know what? I think that's a good point too, even with the pushback, because you need to have trust to some level. So if you are going to the point of a consultant, it's because you need that external review, that external validation. Remember, looking at what you're doing internally to question why you're doing things internally. And, Terry, I know a lot of times we'll joke or we'll talk back and forth about some of the pushback we get. But, that's one thing that I still struggle with when I'm working with clients who just, they come because they want validation, but then they don't want to hear what we say. So I think another starting point is when you're thinking through what it is you're struggling with and what you need that outcome to be, you have to understand that you need to be open-minded, because the only way to really tackle those types of things is to introduce change, right?
Yes.
And a lot of people are resistant to change, but what's happening currently is not working, and there's a reason for that. So be open, because I know both you and I in our approaches, we don't like to just, blow things up and set a fire and then say see you
No,
later.
not at
We're
all.
there to also help you work through it, but it's a collaboration.
It is, and I keep going back to something that I'm never ever going to get over with, a mutual client that we were dealing with, and just bringing them published guidance after published guidance and rules after rules, and just the pushback we kept getting. And then finally, we had to, because it was so blatantly incorrect, we had to say, okay, well, let's look at the False Claim Act. And they said, well, let's take that part out of it. And you and I are like, no, let's not take that out of
Where's your attorney?
it. No, that we're trying to tell you that, we've tried the easy route, but now we're like, look. But
Yes.
yeah, I think when we talk about, we're not laughing because it's funny. We're laughing because the pushback sometimes, think about being a consultant when we are here to help. We are absolutely here to help. That's what a consultant does. We're here to give you some, not just learning the processes of what you need to do so this doesn't happen again, but to give you information so we can hopefully, change the mindset, or at least, and I hate to call it fix it, but find the issues and then move forward, as well as, go back and see if there are things that, we always try to find the positives along with the, inconsistencies, inefficiencies, non-compliance. But sometimes those pushbacks just, we were banging our head against the wall to the point where we're like, oh my goodness, this
Yeah.
is
Well,
crazy.
and that's something too, Terry. I've had quite a few clients, I'd say in the past couple of months that want to meet ahead of time, right? Before
Yeah.
they officially go into an engagement with me.
Yeah.
And I really like that time because I can only put so much information onto my website, and you're not going to know my personality. You're not going to fully know and understand my background, I feel like, if we don't have that initial time to meet and talk through things and, have the opportunity to ask questions. And I say all of that because that part of the process is also vetting for them that, okay, yes, they are an expert. I'm asking these questions, they have responses. And, to your point with that, with all of those resources that we had to give, and they still want to push back and kind of exclude things, just look to our background. I do a lot of defense work, and I know you've done defense as well. You audit a lot on the payer side as well. And, that brings inherent experience that not everybody has that, you know, I would think that someone would welcome that perspective, knowing that we are helping to prepare in the event that those external reviews are occurring.
Yeah, and this gets us to the point of, ensure the consultant's qualified. When you hire a consultant, it's not cheap. You're going to pay a large sum of money for somebody else's expertise that you don't have. So you want to make sure that you're spending carefully, and you want to make sure that you find a consultant with the proper skills and knowledge, and that you are vetting or screening qualified consultants. You want to research, their if they've done any industry publications. Both Stephanie and I both, blog on our website, but we also write articles for other companies as well, reputable companies. We ask for recommendations from, professionals outside the country. We're happy to give references. Look at our websites, look at, previous clients, projects, results. We're happy to give you that information. And, not everything is all flowers and roses. You're going to see some, one of the things that I did, and when somebody asks for reference, it's interesting because I've been in the industry, I'm in my 40th year, so I don't always get that request because they know who I am. I know you've been in here over a little over 20 years, so I know people just kind of know us, but you still want to vet people, either way. But especially if you're using somebody that you don't have never heard of. But I've just noticed that sometimes when you give out a reference, sometimes I'll give one that wasn't exactly what the client thought it was going to be. And I had a client that wasn't, I don't want to say wasn't happy because they've used me 3 times, they use me every year, but it was really funny because I thought, this would be a really good client to as a reference because they're not going to say, "Oh my gosh, she was the best thing ever." They're going to say, "Well, she saved us a ton of money. She found our errors, but we weren't really happy the fact that we didn't she was mad at us or she was really like, how did this happen?" And again, I'm there to, just tell it like it is. And I know you are too. And we're not there just to make sure that this is, and I want to word this the right way. A lot of people hire consultants thinking that we're going to come in and just say, okay, we're going to tell you that everything you're doing is correct, or we're going to work with your policies. That's not what we do. We're coming in to say, well, let me look at your policies. Let's see how this works. There's a reason you're calling us in because either it's usually tied to money, but you're either finding that your reimbursements are not doing well, or there's some kind of inefficiency in some aspect of your practice. And so those policies may or may not be working. And we do find a lot that are appropriate for, the size of practice you have or the organization you have. But we also find that, a lot of practices, and I think this is probably the main thing I find, and you can tell me if this is what you find, Stephanie, they just don't update their compliance. They don't update how they do things. It's still from 20 years ago, still from 10 years ago. And for example, telehealth, I'm dealing with that all week. I have, a couple of different webinars coming up on that. And I've been doing, reporting on telehealth or consulting on it for, a good part of 20 years. But most people only know it from the pandemic. They don't know what happened prior to that. And so I find a lot of times people embrace the past more than get updated for the future. And that's where some of the downfall is. What do you find there?
So I definitely agree with that. And one of the things that I'm coming across a lot more that I think is just due to the financial strain that a lot of practices are dealing with, especially if they're independent from a hospital facility, is that they're also extremely resistant because they only want to look at the money. And, we can't be making these administrative decisions, just like, one of our main pain points in what we do is the concept of incident two. And there's this constant, focus on, I get asked at least once a week, well, I can get 100% of the physician fee schedule if I bill under the physician, right? They have no idea. I asked them if they know what incident two is. They have no idea what goes into that. So that's where I'm getting a lot of pushback right now is that, you know, I think too, I'm changing my thought process here a little bit, but stay
As
with
we're
me.
chatting, that's why
Stay
we love
with me.
podcasts. You can free, you can wing it.
Well, I think that some of it is also because a lot of people have the viewpoint that compliance does not add to their practice financially and they don't see an upfront benefit necessarily if there's not, sometimes there's these gimmicky type sales of things like we can bring you in all this money. But in reality, when I'm in your charts looking at what you have going on, I'm not thinking only about your current revenue. That's a portion of it. I'm thinking about your long-term health and what that's going to look like from a financial standpoint if the government or one of these SIU departments from the payer come in and want to see what you have going on. So I think, again, both of those thought processes are tied to money, but I'm seeing a lot more of that now.
Yeah, I'm seeing that as well. And, as much as we a lot of times find, again, we're in the revenue cycle management space, overcoding or things that shouldn't be coded or whatever. We also find where there's missed revenue. I mean, I find that quite a bit as well. And if, that's not necessarily always the objective, but it's nice when we can say, oh, by the way, this is something that, we see that hasn't been reported or whatever you can capture. But you can't always, and again, I say this generally, and this is would be in any industry, you can't always tie your bringing in an outside consultant to money. It has to be about making sure, and I use the word compliance kind of loosely, but that your organization is compliant with current regulations, with current published guidance, with current legal situations, and also I keep using the word current with what's happening now. We rely on Congress a lot of times for our direction and what we can do, not just in healthcare, but in a lot of different spaces. But it's interesting because, like Stephanie said, we do see that it always seems to be tied to reimbursement, and a lot of practices are like, well, I get paid for that, so it must be right. And just because you get paid doesn't make it correct because they can always come back and take that money away. And that's really what we're here for, to make sure you get to keep your money, make sure that, you're capturing everything, but you're doing it compliantly, legally, and with within the confines of appropriateness based on the published guidance. So I wanted to go a little further into hiring a consultant and really look at the working relationship back and forth. And you kind of touched on it a little bit, and we both did as far as, some of the pushback. But we do have, I really like it when it's super positive. You once you've selected the consultant that's best equipped to assist your company, you need to really talk together and explain, what outcomes and what are your outcomes and expectations? What do you expect them to do? The working relationship needs to be defined. The consultant, can they expect and confirm what materials and data you're going to give us so we can do what we need to do. And then also one of the things that I think is missed sometimes are timelines. Give dates when deliverables are expected to be completed and projects finished, and understand budgets and updates, and try to keep those scheduled meetings, because sometimes I've noticed that when those seem to, when the companies get kind of comfortable with the consultant, it's really sometimes hard to get a hold of them. All of a sudden, it's not so much ghosting where we just don't hear from them, but sometimes it's like, hey, we're finding some things that we need to talk to you about that you have to stop doing right now, or, we're noticing things that can't wait till the end of the project. And, that working relationship is so important, especially from a collaborative standpoint. If it's not the person who hired us, it has to be somebody that is a point person that, whoever that employee is with the company throughout the project, we need somebody to be able to communicate with on a regular basis. And, Stephanie, do you ever find that that is an issue with your projects?
Yeah, and I think that that goes both ways as well, right? Because I've talked with clients before that are frustrated or hesitant to move forward with consulting work because they've had bad experiences with communication before. Or, one of the interesting questions I've been getting the past couple of months from potential clients is, who's actually doing the work? So they're ready to communicate, but they're worried about who's on the other side. It depends on, the structure of the companies, but a lot of times there may be someone who's doing more of a sales type role, and it's not the person who they're actually going to do the day-to-day work with.
Right.
So again, it goes back to that relationship and having that comfort level there. But getting back to what you said with communication on the client's part, that is really important because, for example, for me as a reviewer, this sometimes happens more if I'm doing the legal side of my work, but there's different things that could be deficient in the information that was sent over, and that can really pivot the whole direction that my audit is going to take. So
Right.
communication is one of the most important things to establish on both sides.
Well, and that also brings us to, managing appropriately as far as consultants, and again, on both sides. You can hire a consultant to complete a job on the company's behalf, but it's important that you also remain aware of the project's progress. You keep your routine scheduled meetings. I know one client I have, they want to meet every other week, which is fine. It's usually only 20 minutes. You want to make sure that you're not going over or over budget. And then make sure that also you're paying your consultants. Sometimes that's an issue. Managing consultants successfully requires paying them on time, responding to their requests promptly so that they can work with as few obstacles as possible. Now, as a consultant, we also know that our responsibility is to make sure we are efficient in what we're delivering, that we're making sure that we meet those deadlines, we meet those timelines, and that we stay within our budget as much as we can, unless there is something that's agreed on that would take us outside of that. But that's rare for me. I usually can stay within a budget from the beginning. It's just on occasion when, I had one client that said, okay, we're going to send you about 250 records to audit. And then actually, this was funny. And she goes, actually, it's probably going to be more like 1100. Is that okay? And I'm just like, well, not in the timeline we said we get it done. So I'm laughing because that was, 5 times the amount. But I was just like, I go, we can do it, but it just, you have to make sure that if you do add anything or adjust anything, that you have open communication with your consultant, that they're aware of that, because most of us in the consulting field, we also work with subcontractors. We definitely work with our own employees, but we also sometimes hire outside too of people we trust so that we can get the work done, especially if it increases based on more than what we thought at the beginning. But managing appropriately is really important. And also, going back to the what objective do you have? Think about that before you hire a consultant. And Stephanie, just real quickly, when when you have those, you said they want to meet with you either in person, or a lot of us do now, Zoom calls to for that meeting. How do you talk through a client to start to get them to really enlighten you or give you some kind of objectives on what they're looking for? Because sometimes they don't know.
Yeah. Yeah. So one of the things I actually do to prep before the call is I like to go onto the website just so that I understand the specialty or multiple different specialties, the patient settings, all those various services that they offer. And I also like to get a feel for the organization structure. So sometimes you can find, the person you're going to be speaking with on the website, things like that. And then when we get to the actual meeting, talking through specifics related to, what is happening currently, why is this becoming an issue for you all? What is the impact on the organization? Those types of things help me to understand really the scope of what's going to be needed, because sometimes I'll get asked not only what help do we need, but where does that fit into the services you offer? So it really helps in a lot of different ways to know what service line is going to be good for them, a way to fit it into potentially their budget if they have limitations there, and then also, gauging on my side from project management, time availability, all of those things.
Yeah, and also remember, every consultant's different. Some bill by the hour, some bill by the project, some, bill by the encounter. It just depends on what kind of consultant, what kind of project, what you're actually looking for. So you want to make sure that you confirm the payment methods and the total budget available to the consultant, so that they can also make sure that they prioritize for what the project or what the actual engagement of the contract's going to be. So when the
Yeah, and
consultant,
real quick on that too,
yeah,
Terry, that's a good point because even within my own service lines, there's different patient settings or types of reviews that we just know are going to be really time intensive, or if it's legal related, things like that. So yeah, that absolutely even dictates my own fee schedule that's available.
mine too. And sometimes I'll look at that and go, no, hourly is just not going to work on this based on what it is. And a lot of times, we like to make it a little bit more advantageous to the person that's engaging our services, to the client. So we really try to work within your budgets. I know a lot of consultants do that. Now, concluding the work responsibly, and this is kind of the last point I want to make on that. When the consultant has produced a final report, a review, and to clarify, their recommendations so you can implement them effectively, a lot of times you may often return to the consultant who's helped you, in the past. So, discuss any improvements that you may value in a future working relationship. Consider how the company can successfully integrate the insights of the consultant has produced. I think one of the problems that I see, and this is throughout consulting, and again, I've been doing this for 2 decades, or I'm sorry, 4 decades. God, I just aged myself. It's crazy to me that I'll make these recommendations and then I never see them implemented, and the same audit I'm doing time after time, quarter after quarter, year after year, and the same problems are there. And it's almost like a lot of practices are doing these audits or doing these, um, you know, workflow things, or they're looking at things, and it seems like they're doing it just to say they did it instead of actually wanting to change or to upgrade or advance or, you know, um, come into in line with current compliance standards. And that's a tough thing. You're spending a lot of money on a consultant, so to not really implement the recommendations and then to repeat, what you're doing is what did they say, Stephanie, about doing the same thing over and over again? Insanity.
Yeah,
It's
yeah.
hard because all of a sudden, I know I just did have a client I've had for about 20 years, and we do audits for them every year. And there was a time when they actually were really good. So I said, well, let's just switch it to every 2 years. And then I got it back. I was like, oh my gosh. But I noticed that the recommendations weren't being implemented, and the same problems with the same providers what
Hmm.
were, was happening. And I was just like, you guys realize that this doctor failed the audit the last 3 times. And they're like, yeah, well, we can't seem to, get him or her to change. And I'm thinking, but then why do it? I mean, that's compliance. And even going to take it a step further. One of the things that OIG, Office of Inspector General, has put out this, I think last year in 2023, they updated their compliance module if you take Medicare. and basically added several aspects of you have to have a compliance program plan. And one of them was about patient safety. And safety was a really big thing. It wasn't in there before. And so they were, basically saying if you don't have consequences for someone who isn't passing, your audits and compliance and all the things you're doing, then you're not fulfilling the compliance model that we expect you to have to, be part of this payer. And so you really have to understand that once you hire a consultant, you need to have a purpose. You want to make sure that you successfully integrate the insights the consultant has produced, that select the individuals who best understand the purpose in your practice and reasoning behind why the, consultant made the recommendations they did and what you can do to implement them. And we're happy to help. I don't know if you get kind of that
Yeah.
brick wall sometimes, Stephanie, but it's tough when you see that over and over again.
Well, that's actually what I was going to say, Terry, is take advantage of having a consultant there.
Yeah.
So, a lot of times I find it comical when I come in and do a review and I'll do an initial meeting after the audit with more the, compliance staff or administrative staff, whoever that main communicator is with me on the project. I like to touch base and they'll laugh and they'll say, yeah, I've been saying this for years. But then, maybe we go and do our education session or our one-on-one, and all of a sudden the provider's acting like this is the first time they've heard the information. So,
I
from
get that
that,
too.
yeah, from that perspective, or I know we both get this, Terry, when people are afraid of their providers.
Yeah.
You know, it's not that we enjoy having to deal with that situation, but I'm used to it.
Yeah, me too.
I joke that I'm often the bearer of the bad news, but I also like to be a part of the solution. So, I know with my experience and the different professional skills that I've developed, and I know you have this as well, Terry, but it gives us the tools we need to deal with things and try to bring the atmosphere down, if you will, when, things are getting heated and there's frustrations and at the end of the day, a lot of times these changes really need to happen because of how high the compliance level risk is. So take advantage of us being there so we can, take the blow on some of those things for you.
Well, and remember too, I think you just made a really good point. We are there to tackle the problem that you're having right now, but also you have to really look at what the consultant's recommendations are because how worthwhile was the initial investment? And now you can decide that we are a resource in the future. We're trying to prevent you having to maybe do such an expanded audit if this is what you've asked the consultant to do. And we say audit with a generality, any inquiry, any review of anything you're doing, that kind of falls under that audit phrase. But just to look and see are you doing what you need to do? Are you capturing everything you should capture? Are you reporting this correctly? Is your workflow doing what it needs to do? You're decided. I know a lot of practices are trying to find revenue anywhere they can, and they sometimes jump into, I'm going to start this. And one thing that I get all the time, I just hired an RN and they're now going to be seeing patients for this. I'm like, oh, whoa, whoa. First of all, an RN cannot see patients independently. They can only do things under the physician, the nurse visit. It has to be medically necessary. They get the $20 reported visit, and it's only if it's appropriate. A nurse is not a nurse practitioner. They're not a provider, a qualified healthcare provider. They can't independently bill to a payer, and it's just interesting because I see practices that jump into these lifestyle medicine or some of these and I keep bringing up the weight loss clinic only because not that it's inappropriate, it's just that people don't do their vetting and understanding of things that are, as you know, that are FDA approved versus experimental, investigational, and what all the legalities are there. And just, between that and some of the things that I call it Medicare speak says, oh, you can bill this, but then they don't clarify verbatim specifically what you need. And people,
Mhm.
there's a lot of interpretations out there for things. And We try to give you the most, I hate to call it conservative, but the most best practice, I guess that's the best way to put it, so that you're not tagged in the future for a payer audit. As Stephanie mentioned, I do payer audits and I know what they're looking at, I know what they're targeting, and as well as provider audits. And Stephanie in the defense side, and also, doing provider audits as well, and organization audits and reviews and looking at things other than just coding. We just know what they're targeting. We know what the payers are looking at. We know what the federal government is looking at, and we're just here to kind of protect you. But don't always look, and I'm saying this, I'm saying this with love. Don't always look at a project audit as a one-time thing. What can you do to change the behavior so that you know you're continuing to do things correctly? And Stephanie, what is the thing you always say about compliance? It's a live thing. It's not a, I'm trying to think the phrase you use.
Yeah. Yeah, so it's a continuous thing. It's not something where you check a box and then it's over. Just like you said, it's not just a one and done from an audit perspective because we still need to know, okay, well, what changed like you've been saying, what changed in the next year? And, one of the things that I find is that due to all of the work that I do on the legal side of the industry, there's so many times where people think, oh, it's not going to happen to me, right? Or like you had mentioned, we're getting paid, so it must be right. And, for me, I love the work that I do, but when I have to come in and help attorneys and other firms and everything, it's hard because I know that, they're learning everything after the fact that they should have known before. And this industry is so heavily regulated. It's, I would say it's almost impossible unless someone takes that much of an interest that they're going to take all of their free time to pay attention to what we do in addition to, the clinical side, for example. There's a reason why organizations exist and why we're here to help because it's very overwhelming and it takes a lot of that load off if you're open and just pursue the help and implement it. Don't just check the box and move on because payers are a lot more aggressive now, and I'm finding more and more of my clients that I'm working with are in that regret phase where they realize what they should have done or what they should have listened to up front.
Yeah, and also, you bring up a really good point on this is how I will end today, is that you want to make sure that when you do hire a consultant that you are setting yourself up not just for the now but for the future. That this is something that you're thinking, okay, we want to continue with this. We will, especially if you're comfortable with that consultant. And also when payers inquire and decide that they want to audit you or whatever, if you've had a previous audit that you've done externally, you can basically rely on that and talk about that with them and say, well, I've had an audit. You can also go back to that auditor and say, hey, I have a payer coming in, especially if we said this is fine, we can help you, I hate to say fight it, but we can help you work through those situations. Especially if we already know, how your inner workings are, work. So just be aware that, or just be, really, if you're considering getting a consultant, and I recommend everyone at some point do a practice checkup in the industry, whether you're a small practice, a medium size, a large size, a hospital system, whatever you are, it doesn't hurt to even give you peace of mind. If you think you're doing everything correctly, great. Have somebody take a look, somebody you trust, somebody you really want to say that you could work with, that understands the healthcare industry, and then, make sure that it is somebody in the healthcare industry. I see some people going to attorneys that have never done healthcare, and that's not a good idea. So you want to always make sure you have somebody that really gets your specialty, that understands what it means to report to a payer, what it means to work in the healthcare industry. And we're in the trenches, we're in the field, and just between the two of us, I mean, we've got, over 60 years experience, which is frightening, Stephanie. We're old. This is kind of like, oh my gosh. But I'm like, I don't like to say that out loud. But, and again, you don't have to use
My
us. We're
kids
just
like to
saying,
say it.
I know. I mean, use somebody that you trust and just know we're here to help. So we'd like to thank Stephanie Allard for being on our podcast today. We appreciate your insights on this important consideration to get a consultant or to hire a consultant in the business side of medicine. So Stephanie, thanks for being here.
Yes, thank you.
You can reach Stephanie at stephanieallardconsulting.com, and you can always find me at nschbc.org under Find the Consultant tab. Type in my first name, Terry, with a Y, and poof, there I am. As a reminder, the nschbc.org website offers monthly free webinars on a variety of topics, as well as the quarterly Medicare webinar updates. For all educational offerings, go to the nschbc.org and click on Upcoming Education tab. Also, check out our annual conference, which will be in Savannah, Georgia, June 4th through the 6th. That's it for me today, folks. Please join me next month when we once again bring you the current and important topics in the business of medicine. Everyone, make it a great day, a great rest of your month, and thank you for listening to the award-winning NSCHBC Edge podcast. I'm your host, Terry Fletcher.
Thank you for listening to the NSCHBC Edge podcast. Join us on the second Tuesday of each month as our consultants tackle the complexities of navigating the business of medicine. You can reach us on the web at nschbc.org, the National Society of Certified Healthcare Business Consultants.